very, very pleased to be with you on this important occasion, just the day after National Doctors' Day. As Dr. Bhatti reminded us, Doctors' Day, the 1st of July, was the birthday of Dr. Chandra Roy. It was also, amazingly enough, the date of his death. So we're commemorating both his birth anniversary and his death anniversary when we honor Doctors' Day on the 1st of July. And on that occasion, I'm sorry to tell you that while we were all celebrating and commemorating Doctors' Day, a couple of thugs in my home state assaulted a doctor, leaving him severely injured and sent him to hospital. And this is a reminder that 75% of all doctors have experienced some attack or the other in some form throughout this country, and the Indian Medical Association has been bringing some of this data to our attention. This is why I was motivated a couple of months ago to speak in Parliament under 0 hour on the urgent need to tackle on a war footing the question of violence against doctors. The public consciousness about doctors has grown dramatically during COVID, because the COVID pandemic reminded everybody when their lives were all in peril how much we all depend on doctors and, of course, nurses and other medical staff to keep us alive and keep us going in times of great stress and danger. Now that the pandemic is largely behind us, it is not a time to forget doctors. If anything, the time to appreciate their extraordinary service is all the greater when it's come after our own realization of how perilously close all of us were to some very, very serious health conditions during the pandemic. And this is why when the government had withdrawn, as Dr. Aggarwal explained to us, the draft bill that had been introduced in 2019, which was withdrawn on the grounds, exactly the reason that was given, was that chartered accountants and engineers would also ask for a special bill to protect them. The Home Minister took the view that violence is violence, it is illegal, it should be stopped, it doesn't matter if the victims are doctors or not. But the problem is that doctors are working in very special circumstances. You are in a clearly identified environment, namely that of a hospital or a medical clinic or a medical practice. You are meeting with people whose lives you may have to save, but whose lives you may fail to save for good or bad reasons. There is a tremendous amount of anxiety and tension present around the doctors, around the patients, around the patients' relatives. And in these situations, combustible tempers can easily result in violence. I was shocked to discover that my own rather small state, Kerala is a state of less than 40 million people, there were 137 attacks last year alone on doctors. And in fact, I received the reply from the health minister to my speech in Parliament, giving the specious argument that it is only because other professions would also demand such an act that they withdrew this bill. Within a day or two of my receiving his letter, which is a couple of weeks after he sent it, that's how the post works from the government, a young doctor, 26-year-old doctor in Kerala, was stabbed to death by a patient, and a patient who had been brought in by the police. Somebody who had assaulted his own family members had been arrested, had injuries and complained of whatever condition. He was brought into the hospital. This doctor was a recent graduate. She was doing her community service in a taluk hospital. And she was stabbed to death by this criminal madman, I suppose one could say, but also one can say this criminal patient who was also somebody whose wound she was trying to tend to. Now, in these circumstances, the urgent need for action could not be greater. So I replied to Dr. Mandavia, and I rejected his argument. I was trying to find on my phone the letter just to share with you some crucial points. One of the points I made is, because Dr. Mandavia also said, by the way, and you should be familiar with these objections, he also said that health and law and order are both state subjects, and therefore there should be no central legislation on the matter. That's another reason why they withdrew the bill. I said, however, the Union Parliament may legislate on matters relating to legal, medical, and other professions as listed in entry 26 of the concurrent list. And therefore, there is a counter to the legal argument that this is a state subject. No one is preventing the states from also passing a law if they want to. But the fact is that we can have a parliamentary law which will apply to all central establishments, but it can also be the law of the land unless and until a state law overrides it or modifies it. It is not accurate, I told Dr. Mandavia, to equate the situation of doctors and other health workers who provide critical and essential life-saving services with other professions such as chartered accountants. And that, I've rejected that argument completely. There is also the argument that the Indian Penal Code and the Code of Criminal Procedure contain provisions to tackle all cases of violence. That's the Home Minister's argument. However, they are not tailored to deal with violence against healthcare workers who face unique challenges and risks. Now, the Kerala government had a law. It was a law that was passed, I think about 7 years ago, 2015, against violence against medical professionals. When this tragedy took place in Kerala, Dr. Vandana Das's murder, they enacted immediately a new ordinance in December 2022. I beg your pardon, in May of 2020, April of 2023, and that ordinance will come before the Legislative Assembly very soon. The ordinance, for example, goes beyond the provisions of the central government's draft law, which has been withdrawn, which would have had a punishment of 5 years imprisonment for anyone attacking a doctor. The Kerala ordinance makes it 7 years. But apart from that, my concern is that the law on the books in Kerala since 2015 had not resulted in a single conviction. Now, a law cannot be expected to have a deterrent effect by itself. After all, it is illegal to commit murder, but murders still happen. What we need is exemplary action, punishment, and conviction. Conviction and punishment. And for that to happen, you need to have a certain political will on the part of the government. My concern about all of this is that we really have to take a special note of the fact that medical practitioners and doctors in particular are uniquely vulnerable. When the Epidemic Diseases Act of 1897 was amended in 2020 to include sanctions for any violence against healthcare workers, these provisions are limited to pandemics and endemic situations. In other words, somebody going to conduct a smallpox vaccination or a polio vaccination, if you attack that person, there is a special punishment for you. But if you go to a hospital and attack a doctor, there is no special punishment against you. Now that is the strange situation that we have here. So I have made it very clear to Mr. Mandavia that he should reintroduce the bill. In the meantime, I will take it upon myself to introduce a bill. Now, under the rules of the Parliament, I'm not allowed to share with you anything about the bill, its title, its contents, what I intend to do, because if I do and it becomes public that I've shared it with you, then it is apparently ineligible to be introduced. It's a very obscure provision of Parliament, but that is the rule. So I'm going to not share with you the details. But I will say to you that any suggestions you have will be noted by my colleagues here, and we will take those suggestions into the bill when we introduce it in Parliament. What is extremely important is for you to understand, and I want to make this clear to Dr. Aggarwal as well, that private members' bills are very, very rarely passed. What they serve is the purpose of setting the agenda. They bring the public and the government's and the parliamentarians' attention to a particular issue. And once the bill has been introduced in Parliament, even if it is not selected for discussion or voting, we can go public the next day or the same day and we can talk about this. I will talk about it. The Indian Medical Congress should talk about it. The Indian Medical Association should talk about it. We should multiply the voices throughout the country saying that such a bill is the demand of doctors and make it difficult for the government a year before a national election to ignore such a demand. Remember that one great advantage we have is this issue has become topical literally 11 months before a national election, a general election to the Lok Sabha. No government wants to antagonize the very large population of doctors and medical practitioners in our country. So if you all join us in making this a major issue, I'm fairly confident we can persuade the government to take over my draft bill, which is, I can tell Dr. Aggarwal, is an improvement on their draft bill, and they can then introduce it to Parliament. But if they don't do that, they will have the black mark that they neglected the needs and demands of a very influential and important community in whose hands their own health lies. So with those words, I want to once again thank you all for coming in such large numbers. I know that Dr. Bhatti intends to open the floor to suggestions, questions, comments from all of you. I just wanted to say from my side that I am with you. I have been with you since this issue was first made, that I was first made aware of it. I've been with you in my speech in Parliament. I have made several other speeches to public gatherings, including with AIPC functions in Thiruvananthapuram and Kollam and elsewhere, trying to get doctors to be conscious of the importance of what we want to do. And now in Delhi, we have this very large, important group of doctors. We will work with you to deliver safety and justice to our doctors. Thank you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.